Welcome. My name is Bob Drake, and I'm delighted to be here representing the Johnson & Johnson Dartmouth Community Mental Health Project. I'm a family member myself. I'm also a researcher and a practicing physician for the last 30 years. I started out, like many of you, skeptical about the importance of encouraging people with psychiatric disabilities to return to work. But one thing I've learned over the last 30 years is that nothing we do in mental health is as helpful to people, as impactful to people, as helping them to get a job in the community. It helps people with self-esteem, it helps people to have a community network, it helps people to have a sense of purpose, it helps them with income, obviously, and it launches many, many people on the pathway to recovery. The Johnson & Johnson Dartmouth Community Mental Health Program began in 2000 with a gift from the Office of Corporate Contributions at Johnson & Johnson. It's important that this is all a manifestation of Johnson & Johnson's credo to be good citizens and to be responsible to the communities in which they run their businesses and in which they have their employees. We at Dartmouth helped the Johnson & Johnson Corporation to find partners in states and communities in order to implement evidence-based supported employment programs. The program now operates in 10 states and the District of Columbia, and I'm delighted to be able to report that literally thousands and thousands of people have been helped to return to employment and been launched on the road to recovery as a result of this program. The purpose of this video is to illustrate some of the important skills that support employment specialists use in helping people to return to work. We're going to talk about 3 specific skills today. These are not the only skills that support employment specialists use, but these are 3 of the important ones that they use again and again and that we get questions about all the time. The first one involves working with employers in the area of job development. The second one involves working with clients and families to help them to develop a good job match that's consistent with their preferences and their goals. And the third is working with people who have co-occurring mental illness and substance use disorder, since that's often viewed as one of the hardest tasks that employment specialists do. Now, how to use this video. The video occurs in 3 modules. They're on the 3 topics that I just mentioned: job development, vocational profiles, and co-occurring disorders. We recommend that you watch each module separately, listen to some of the discussion by our expert panel, and then discuss the module among yourselves and think about what this means in terms of how you provide services. Now let me introduce our expert panel to you. First is Debbie Becker, who's the Director of Research and Training on Supported Employment at Dartmouth. Next is Stephen Baker, who directs all of the supported employment services for the Commission of Mental Health in Washington, D.C. Third is Jean Alvey, who's the Coordinator for Vocational Rehabilitation in the state of Illinois. And finally is my colleague David Lind, who's a co-director of training at Dartmouth. Let's get started with the first module on job development.